Good evening, ladies and gentlemen. My name is Dixon. I'm a psychiatrist. I live and work in Zimbabwe. I developed a project called the Friendship Bench in the year 2006 in response to the high attrition of professional healthcare workers and the very high rate of depression in my country. I'd like to tell you the story of the Friendship Bench. Now, firstly, depression. Depression is a debilitating condition which affects millions of people globally. In fact, the World Health Organization estimates that by the year 2020, it will be the leading cause of disability globally. Now, in my country, Zimbabwe, more than 30% of the people utilizing primary healthcare facilities suffer from depression, and we don't have the services to care for these people. The treatment gap for depression is massive in my country. There are 8 psychiatrists for 12 million people. I am one of those psychiatrists. In fact, I'm the only psychiatrist who works in a public health facility. The rest are in private practice. So the Friendship Bench was developed in response to this high attrition and the huge treatment gap that exists. And it was set up in 2006. And we work with lay health workers. And these lay health workers are trained to deliver cognitive behavioral therapy, essentially based on problem-solving therapy. And to date, we've treated over 5,000 people, and 92% of these have been managed successfully by lay health workers. But our biggest problem is postnatal depression. More than 33% of mothers visiting the local healthcare clinics suffer from postnatal depression. Now, we know from evidence that untreated postnatal depression can affect not only the mother, but it affects the children as well. Delayed developmental milestones, and with most of our mothers who are HIV positive already, it affects compliance or adherence to antiretroviral medication, which increases the risk of resistant strains and further fuels the epidemic. So we plan, with your support, to introduce a screening package to identify mothers at risk of postnatal depression and use this intervention to provide them hope. With this intervention, we do believe that we can reach out to thousands of mothers in Zimbabwe who have postnatal depression, and we have the scientific evidence to prove that this works. I can talk about that later, but for now I'll hand over to my colleague here to give you a little bit more.
Thank you. My name is Dorcas. I'm going to share with you the experiences that I had with the Friendship Bench. These ladies, lay health workers, like Dixon said, carry up the 92% of the workload. They are committed, they have got the passion. Why? Because they are beneficial to themselves, to the Friendship Bench. This is just the bench itself that I'm just trying to show you that they actually use when they are supporting their clients. I was privileged to work with some of the clients with depression. The case number 1 that I worked with was a young lady, only 24 years old. She was pregnant, she had a cesarean section. She was given a baby, but a few hours later, she was told the baby had died. So she had to go home. She had no support. Fortunately for her, she's got a mother-in-law who is a lay health worker. Managed to refer her to the Friendship Bench, screened her, and found that definitely she had depression. And through problem-solving therapy, just Dixon said, we managed to work together because it helps you to identify major problems. You then have to storm and come up with solutions And one of her solutions was she could go to church and she could sing, and somebody recognized her talent. Second one, I just want to say, there was somebody that I was working with. She had a problem. She had HIV. She was not taking, and these are her words, ladies and gentlemen. I hide my medication under my bed so that my friends would not see what I was taking. If only she could had any intervention. She died before we just walked out to go and revisit. Any successes? Yes, there was success. That lady, HIV positive, she had support, Zimbabwe project. If it was not for the friendship bench, I would not be here today. Those were exactly her words. Ladies and gentlemen, I want to give it to Dixon.
Lastly, for a few seconds, I guess, I'd just like to say, to emphasize once again, we have the scientific evidence to support this project. But what we need now is that little push so that we can reach out to thousands of mothers in Zimbabwe and we can truly make a difference to the friendship bench. Thank you.